last little while we've talked a lot about lower body issues as spring and summer start to get closer, people playing soccer, making sure we have good mobility in our hips, make sure we're not doing anything to injure our lower leg. We're going to shift focus to our upper body. Again, when we're outside, we might start playing volleyball, doing exercises that get our arms overhead quite a bit, so shoulder mobility becomes a big issue. People start injuring their neck, shoulder, elbow because of lack of upper body mobility. So we're going to try to do a couple of quick tests just to see where my biggest limiting factor is, and then in another video we'll talk about some simple fixes that we can start to implement to try to improve the mobility, stability, and strength of our shoulders. So first thing we have to understand is my shoulder floats on my body. The ball and socket joint sits on my shoulder blade, and the only bony connection any of that has to my body is where my collarbone meets my sternum. So that means for all the great mobility we have, it's all muscular stabilization. So we really have to make sure that those muscles are well balanced. And because those muscles attach up to my neck, up to my middle back, and in some cases those muscles run even down to my lower back, I've got to make sure all of that stuff really works well if I want to have healthy shoulders. So I would first make sure that I've got good range of motion in my neck. Can I, with my mouth closed, touch my chin to my chest? Can I extend to about 10 degrees and parallel to the ground? Can I get about 80 degrees of extension? Can I rotate so that my nose meets about the middle of my clavicle on both sides so that I have good flexion, extension, and rotation in my neck? If we don't, we're probably going to need to have that addressed either by a manual therapist, chiropractor, physiotherapist, massage therapist, whatnot. From there, we're going to come down to the actual movement of the shoulders. So I want to know, do I have normal internal rotation and normal external rotation of my shoulders? You should be able to reach your hand to the border of your opposite shoulder blade and to the top of your opposite shoulder blade. And those should be symmetrical. You don't necessarily have to test them both arms at the same time, but I would make sure that I've got normal internal and external rotation. For most people, the challenging one is going to be dominant arm, or at least right arm, since we live in a right-handed world. Right arm internal rotation is usually the one that gives most people trouble. So just because I feel that limitation, that doesn't mean that's all about my shoulder. That could have to do with my upper back. So I want to know that I've got good ability to flex my arms overhead. I should be able to get my arms vertical without creating any excessive extension of my back. So one of the ways that we're going to test that is, we're going to come and lay on our back. The lat is one of the muscles that might limit my ability to raise my arms overhead. Without bending my elbows, I should be able to get my arms flat to the ground here. Because my lats run down and attach all the way to my lower back, some people with a really overarched lower back, if we flatten out that curve, all of a sudden they lose the ability to extend their arms. That's no good, because that means if I truly get overhead with a weight, I'm going to have to arch my back to make that happen. I'm not going to hurt my shoulder, I'm going to hurt my lower back. So to truly test it, we're going to pull our knees into our chest to flatten out our lower back, and then with my arms perfectly straight, I'm going to reach overhead and see if that's problematic. I can compare one side to the other. You may feel like one side is tighter than the other, but if you feel like you just kind of hit a wall and you get blocked, and then if you let your legs fall and you can touch the ground, that means that we're super tight through our lat and we're having a problem where we have to extend our spine to get normal full range of motion. So we've looked at range of motion of the neck, range of motion of the actual shoulder and our lat. Looking at range of motion of our upper back, we're going to test to see whether we have good extension and rotation of our spine. We've done this in a couple of videos before, but if I were to sit back on my heels, come down onto my forearms, and put my hand behind my head, make sure that my arm is in the same plane as my shoulders, can I rotate past 50 degrees? So again, some people we may see that they get really stuck kind of early, meaning they lack mobility through their upper back. I can compare this with my hand behind my head or my hand behind my back to take out some of the demand on the actual shoulder, and obviously I want to test that on both sides to see if I have symmetrical range of motion. So if I lack mobility through our thoracic spine, that's going to affect the position of your shoulder blade and affect, again, your ability to get overhead or do any exercise with your shoulders. So that's kind of some very, very quick testing. Range of motion of the neck, range of motion of the actual shoulder, looking at it with the stiffness of our lats and the mobility of our thoracic spine. We'll come back in just a second and talk about how we try to fix most of those things.